My name is Dr. Ester Cole, and together with my co-editor, Dr. Maria Kokai, we are very excited to share with you information about our just published international edited book. And the book is timely because it addresses the very needs that school communities need and will benefit from during the coronavirus pandemic in the aftermath. I have been a psychologist for many years, not only in private practice, but acted as a supervising psychologist of multicultural services and teams of psychologists in a large metropolitan school board. In addition to that, I acted for many years as an adjunct professor of graduate programs in psychology. And now I'm going to have Dr. Maria Kokai introduce herself.
Thank you very much. I'm a school psychologist, and I spent my entire career of over 35 years working in an education system. So for the first 2 decades or so, I was providing psychological services to students in schools, and that was followed by 14 years in the position of chief psychologist with a large urban education system with about 90,000 students. I'm a great believer in the full continuum of psychological services and the consultative, indirect, as well as direct services. So collaborating with Esther and with the other wonderful authors who contributed to this book was very, very rewarding.
This is an excellent question. Over the years, people asked me in presentations and workshops and in collegial boards, when is the next edition being published? The world has changed significantly. Access to information meant that awareness of evidence-based practices and effective practices in terms of time commitment is called for. In addition to that, a full continuum of services that was advocated is seen now as needed more than ever. We want reliable, trusted models of service that are not just providing schools with a fraction of the role psychologists can play in meeting the needs of school communities. This book gives a continuum of examples of primary, secondary, and tertiary prevention and intervention without being only reactive, but methodological in its planning, so that the model itself means that psychology departments or individuals or community service providers can look at the model and say, where do we fit in it? How can we best collaborate? And this is why the expansion of services through shared knowledge and collaborative skill development processes are part of consultation that is effective. In the book, we also make use of significance in technology. By having the online appendices and portals in this book, it means that we assembled not only the best mind and leadership in a given area, whether it is dealing with inclusive school communities for providing leadership and services to gifted children, but also regrettably making sure that when there is a mass casualty, school communities can benefit from knowledge in psychology and the model, how to plan and intervene in a timely manner. The online appendices have for every single chapter resources that can be accessed, that can be updated locally, shared with others to maximize in both an economically effective and in terms of time on task responses, the very best that school psychology can offer internationally in a just society that maximizes services for its learners.
I just would like to add that since 2003, there has been a lot of research indicating the connection between academic learning and mental health. Now, thankfully, by now, there is a growing recognition of the importance of the role schools should be playing in the support of mental health and well-being of their students. However, I have to say that the way the role of school psychology is being seen, this has not really always caught up with this recognition. And with the book, we want to support and urge school psychologists and those who use their services to really capitalize on the full range of their services and expertise.
This book is essential because there is a tendency to be reactive in planning, and because there are reforms in education and new leadership that wants to address the agenda of the ministries of education or of a particular school, school psychologists have been the recipients of certain assignments. And because of that, it is essential to share the wealth of knowledge the school psychology profession can bring to the table in terms of problem solving. And shared knowledge is paramount in every organization that is progressive and takes into account what are the collective goals. What is the action and the action plan that follows? What are the expected outcomes and how can we monitor it? There is so much that can be done because schools are trusted and they are the hub and heart of communities, that school psychologists can bring consultation expertise in addition to clinical service assessment and counseling models that are not necessarily addressing the multitude of needs that are bestowed upon schools and are asked for intervention. In addition to that, there are other readers who will benefit. For school psychology leaders to come to administration leaders and to provide in-service and to provide consultation and see the linkages between what our model can offer and how it can best need and assist and meet the needs of others in the system is a valuable contribution by people who know the culture of the schools, by people who are trusted, by people who can advocate together on behalf of multilingual and multicultural school communities. In addition to that, we believe, and have been proven so, that the model can be a very valuable academic resource for academics who teach future psychologists, for research impact, for evidence-based and evidence-informed research that shows that sometimes various practices, whether they are academic or in mental health, unless they have been proven to be effective, are not necessarily capitalizing on the evolution within the field in order to satisfy those who need the most to say that they are the students. Those are the people who are going to be the future adults. And the more independent they are, the more they learn the connection between how they feel about themselves, how they trust themselves, how they socialize, how they react to situations that are frustrating, the less they give up and the more they benefit from the educational outcomes, which are the raison d'etre of every school system.
That's great, Esther. Just one more point. The subtitle of the book is A Guide for Scientist-Practitioners. So I just wanted to point out for those scientist practitioners out there that Each chapter contains the most recent research about the topic. There are a lot of evidence-based strategies offered by the experts in the field, and the handouts, as Esther mentioned, that are available online for the book contain very good, very helpful hands-on materials. So these are the pillars really for scientist practitioners.
We included chapters that in fact are walking the talk of the model. That is to say, we wanted chapters that are going to educate the system, future practitioners, scientist practitioners in the field, and researcher about the fact that primary prevention and intervention has information that is helpful for all students across the age ranges, across the age groups, and transition from one institution to another. So the example about gifted education or how to help through consultation support teachers in their interactions with groups of students in classrooms through motivating students, those are examples that are primary prevention. They apply to everybody, all through the system. The second reason is secondary prevention, when there are problems that have not been necessarily compounded by hardships and severe trauma, but we wanted chapters that are saying, how can we acknowledge problems, address them early on before they mushroom into become debilitating and impacting in a negative way on everybody who is suffering, whether it is from bullying or depression or anxiety. How can we maximize interventions? The third one, the third component is when there are extreme problems, whether they are relating to, unfortunately, students who are behaving in ways that are harming their bodies by self-cutting when they cannot express and receive support for what ills them, what pains them emotionally, or as noted, unfortunately, when there are mass casualties because of community disaster responses and disaster experiences, whether they are made by men and women, whether they are made by nature. So we wanted to make sure that it's useful for everybody, whether you work in a clinic, whether you specialize for your dissertation at the university level in an area that will contribute significantly to your work, but we also wanted an umbrella for scientist practitioners that are saying, whether you experience this problem once in a while or whether you experience this challenge, not necessarily a problem, you are going to have the immediate user-friendly resources and up-to-date literature that will be your friend. By that, it means that you are going to bring to the collective table of the multidisciplinary consultation knowledge that you are going to be able to translate in ways that are going to maximize everybody's role in problem solving. So these were some of the decisions. And of course, as we said before and will continue to say, we were very, very fortunate to have had networks that allowed us to bring the best in the field that the field can offer from the United States and from Canada, and collaborators internationally with them to make sure that the chapters are standing alone in their contribution to the field. The COVID pandemic has also been called advisedly the mental health pandemic. In fact, we all are learning as we go along and how to solve the casualties and the impact of the pandemic. in addition to post-traumatic growth that needs to be acknowledged, where families and people of all ages discovered in themselves coping skills that they didn't know they had. They have new appreciation for small things, and school psychologists can help people reframe the pain and also make sure that they are reminded to practice self-care, which is part of the healing process. But more specifically, when we have data that shows that stress, even in self-surveys, self-report surveys are showing throughout the last year and over that, in fact, the growth of the self-identified people who have stress is impacting how they interact with themselves and with others, how they are going to cope when the world will supposedly get to be the normal world again, if ever. At the same time, what we have to position ourselves is with models that are going to be learning models that are easy to implement. And our book offers the kinds of, at your tip of the fingers, resources that are saying, let us try. We know how much we don't know yet, but what we do know is that children need to learn and socialize with others. Children need to be gradually reintroduced to cross the bridge from Zoom learning and sessions where they see squares with other children and adults who teach them, to actually be able to communicate non-verbally and verbally, to be able to catch up on things that have been missed, not only in reading and writing. What about the children who have special needs? What about the children who gave up? Adolescents who only have virtual interaction with others all over the world? How do we deal with the number of people who lost family members, friends, who are suffering because the pain is so overwhelming? What about the children who are living in conditions of deplorable hardships that are impactful because of the intersectionality of low socioeconomic factors and lack of schooling or lack of exposure to recreational activities and to language skills if they come from situations where English or their native language is not acknowledged as part of their learning community? We have to assume that we are all going to learn together to find problems. Nobody knows. None of us are as good as all of us. And this includes school psychologists, educators, decision makers, and leaders in the field. What we do know is what can be helpful and trusted resources are, and evaluating them and supporting others in times of need is going to be a long haul, which will be evaluated, and new resources will gradually be magnified, utilized, discarded, or revisited.
I would just like to add, as someone coming from the education system, that children and youth experience the pandemic under different circumstances, and their responses to the pandemic will be varied and different. One thing is certain, that schools and school-based mental health professionals will have to be ready to provide the full range of services to support students' mental health, from primary to secondary to tertiary prevention and intervention, in a very systematic and organized and planned way to deal with the aftermath of the pandemic.
One of the main messages that we would like to share is we hope that our labor of love, this book, is going to be helpful, is not to see children's mental health as an add-on to education, but as an organic factor in learning and helping kids develop wings that will make them productive adults in society, regardless of what they are and who they are. I think it's very important not to regress back to weeks where they say children will have a week of anti-bullying, or this is a celebration of diversity, or this is a celebration and a week of self-esteem promotion. It has to be weaved into everything that is done. And if you have that kind of approach, regardless of the educational mandate, we teach people, we teach children and adolescents as a whole, rather than subjects. If we do that, we are also going to have more active learners who are going to develop executive problem-solving skills and learning skills that are going to be easy for them to bridge from one subject to another without giving up. It is also going to promote the kind of motivation and love of learning that in an era of rapid technological growth and changing professional orientations and affiliations is going to be paramount. So if we start with the point that learning, socialization, and mental health promotions are all siblings within the same family, we are also going to adjust our educational kaleidoscope and make sure that every teacher, every support staff, every leader in education and in community services are going to keep that in mind when they make recommendations, when they do knowledge translation, rather than medical model services only that are not necessarily the best fit for mental health promotion and prevention, and are also going to be able to do something else that is vitally important in a child's mental health education and flourishing. This is the partnership that you can cultivate with parents between home and school. Those are the kinds of partnerships that are going to say to children, I feel like a somebody, and my parents and my teachers and my school are a way of making sure that I know that school is away from home, a home away from home. And those kinds of skills are going to help children who are immigrants, refugees, people who live for several generations in the same environment. All of us need the same kind of organic, interrelated, and interconnected linkages in order to continue to cultivate our garden of future adults.
And by making mental health supports universally available, schools can basically ensure equitable access to all students throughout their school career without stigma, without barriers, and schools are the ideal places where this can happen.
We would like to comment in conclusion that this has been a voyage of incredible modeling of collaboration despite the pandemic, despite the hardships and the needs to adjust. We would like to say that out of the rough, this diamond came about and already has received praise from our colleagues. And I hope that others who would like to communicate with us will make sure that they report to us periodically, not only what questions they have, and we are going to be available, but also how they used it and ideas that make sense to them in their setting, whether they treat families, whether they work with schools, classrooms, individual teachers. It's most rewarding to know that they can factor in some of this knowledge and professional development that they share with others. We are available. We would like to know that the book is helping future practitioners and youngcomers to the profession to have both the kind of umbrella of equity, diversity, and inclusion, not only on behalf of others, but also on behalf of the profession. If we look at that within the profession, we are going to have the face of school psychology, the face of communities, and that will increase the trust, the equity of access to education, equity of outcomes, and ethical behavior that says to all of us that school psychology is at the heart of communities for a reason. And we look forward to maybe having a fourth edition in the future, or at least to make sure that you encourage us to continue to collaborate with you in any way that you feel will enhance your services and advocacy on behalf of school communities.
And I know that as a psychologist and as a system leader, this kind of resource would have been very, very helpful for me, and it would have made a huge difference in my daily work. So I am sure that it will be a great go-to book for practitioners, students, and early career psychologists. And we, as Esther said, we would really like to hear your feedback. And thank you very much.
Thank you. And thank you to my wonderful partner on this road ahead, Maria Kokai.
And likewise, thank you, Esther. It has been a great process and a great result. Thank you.